So without further ado, I would say we get started. Today's session will be chaired by Dr. Debbie Gibson, Professor of Pediatrics, Division of Nephrology, University of Michigan, and co-moderated by Dr. Sunil Idani, Consultant Physician Nephrology Associate, Northern Illinois, Dr. Kirk Campbell, Associate Professor and Director of Nephrology Fellowship Program, Icahn School of Medicine, Mount Sinai, Lauren Lee, Chief Research Officer, Nephrology International, and myself from the Permanente Medical Group from Kaiser Permanente here in San Francisco. So without further ado, I give it over to Dr. Gibson.
Thank you so much. Welcome, everyone. We want to be certain that you all know where you are. So you've joined into this call from GlomCon, supported by both Kidney Health Initiative associated with ASN, as well as NephCure Kidney International. And this particular session today will focus on clinical trials in children with glomerular diseases. We have just a lovely lineup of speakers today, and we promise to reserve time for questions and answers at the end, but we'll have our speakers present one after the other as we transition through. Our first speaker will be Keisha Gibson, who comes to us from the University of North Carolina, where she's the Chief of Pediatric Nephrology. Carla M will follow, and she is the Division Director for Pediatric Glomerular Disease Clinic and the Division of Pediatric Nephrology. She also is an internal medicine physician, so she's a lifespan type doctor, so we appreciate her participation. Followed by Jula Inrig, who is a physician at UC Irvine and Duke University, so she sort of spreads her wings wide and is the global head for the Renal Center of Excellence at IQVIA. And finally, Suzanne Vento, who's a clinical research nurse who manages clinical trials and actually against her portfolio at NYU Medical Center. And so for the speakers who are here today, thank you so very much. And we'll just move right forward and begin with Dr. Gibson, who will talk about the renal epidemiology of glomerular diseases in children. Keisha.
Wonderful, thank you. If we can advance to the next slide. So thank you everybody for joining today. I wanted to start the discussion off today explaining a little bit about the epidemiology behind the children that we care for with nephrotic syndrome. So as many of you on this call will recognize, the burden of disease is largely in our younger age group with children aged 2 to 7. For reasons that are unclear, boys are affected twice as commonly as girls. I wanted to make sure that we address that we have a very diverse group of people joining us on this call today, so I thought it was important for us just to review a little bit of nephrotic syndrome. So we recognize that this syndrome is associated with large levels of protein loss in the urine, which then result to lower levels of protein in the bloodstream. And while we recognize that there are many types of proteins that are lost in the urine, there are some that are quite important, like albumin, to help maintain fluid inside the blood vessel space. And so when our albumin levels are low, we have leaking outside of the blood vessel space that results in the swelling that many recognize clinically in our young people. The liver is busy at work trying to replace a lot of these proteins that are lost, and thus the internal factory is turned on to increase cholesterol levels. So hypercholesterolemia is another hallmark of this disease. Typically, we do not expect to find blood in the urine. Our children present with normal blood pressure and normal kidney function, but we recognize that any of these entities can in fact be present in up to 15 to 20% of children with nephrotic syndrome. Next slide, please. It's very important for us to recognize and remember that nephrotic syndrome is in fact a symptom. It is not the disease. And so just as we think of a cough, being able to represent somebody who has asthma, pneumonia, acid reflux, nephrotic syndrome is indeed associated with many different diseases, anything that affects the podocytes of the kidney. In our age group, we typically find minimal change disease, FSGS or focal segmental glomerulosclerosis, and on smaller scale membranous nephropathy. And again, as nephrotic syndrome can associate with other diseases, other glomerular diseases like IgA, and lupus definitely can be associated with nephrotic syndrome. The prevalence of nephrotic syndrome in children is around 16 for every 100,000 children less than 16 years of age. Represented in this slide is data from the Nephrotic Syndrome Study Network, which enrolled both children and adult patients. And if you look along the horizontal axis, you'll see advancing age.